Hey class, my genetic research project is on neurofibromatosis. Neurofibromatosis, or NF, is a genetic disorder that affects the nerve tissues of the affected, causing tumors to grow in these areas. These tumors are called neurofibromas and develop mainly in the supporting cells surrounding the myelin sheath. Neurofibromatosis also results in many different side effects. For example, where tumors grow, pressure may increase on surrounding nerve cells, creating pain and visible lumps under the skin. The disorder also affects melanocytes, causing discoloration of the skin and may even cause bone deformities. Cognitive problems are also associated with NF, as well as hearing loss and, in some cases, extreme pain. There are 3 different types of neurofibromatosis: neurofibromatosis 1, neurofibromatosis 2, and schwannomatosis. The severity of these symptoms varies between cases, with some being mild and non-life-threatening, while other cases present examples of large amounts of tumors, some so large that they weigh more than the victim, with severe disfigurements. For example, in Vietnam, a man had a 200-pound tumor removed from his leg that weighed more than the rest of his body. That must have been decidedly uncomfortable to live with. Neurofibromatosis is caused by a genetic mutation on the long end of chromosome 17. The mutation occurs when chromosome exchange takes place between chromosomes 1 and 22 and chromosome 17. The mutation specifically affects a gene called neurofibronin 1, which acts as a tumor suppressor. Neurofibromatosis is autosomal dominant and affects males and females equally. So based on what we've already learned, if one parent has neurofibromatosis, then their children have a 50% chance of getting it. Unfortunately, 30 to 50% of the new cases of NF are caused by random genetic mutations, regardless of whether or not your parent or anyone in your family has NF, which kind of sucks. However, there are tests that can be done during pregnancy to determine whether or not your child has NF. However, that only works for NF1 and NF2 and not for schwannomatosis. The chances of getting NF1 due to random gene mutation is low, however, with only 1 in 10,000 Americans, because apparently Americans are the only people that they do in these studies, can get NF1 in their lifetimes, and for NF2 it's about 1 in 45,000 chance of getting it. So if you do get neurofibromatosis, there is no cure. However, there are treatment options that have proven to be effective. Surgery is basically the only really viable option that doesn't result in any undue pleasantness. I mean, besides the fact that doctors are cutting off lots of small lumps of tumorous growths. But surgery is proven effective in treating all types of NF, with only a small risk of hearing loss in the patients with NF due to the proximity of the tumors associated with that disorder to the nerves connecting the ear to the brain. So the tumors happen mainly in the nerve cells near the ear, which causes some problems when you're trying to cut those tumors out. So the surgery may remove the tumors. There are many complications that arise from neurofibromatosis even without the tumors. So these range anywhere from cancer, with the tumors becoming cancerous, to nervous system disease, which is not pleasant. All that can be done besides the surgery is to treat these symptoms as they arise. So for the cancer cells, they go under radiotherapy and chemotherapy, and for nervous system disease, well, you're kind of screwed. So this concludes my presentation. References can be found below in the dooblydoo and right here, although you can't really see it. And since this is my 23rd attempt at making this presentation flawlessly, it's not really my 23rd, but it's close, I should at least get an A for effort, even though effort in this case starts with an E. So to recap, NF is caused by mutations, which leads to tumor growth, which leads to many different complications, which can only be helped through treatments because it's not curable. And it's caused by mutations on chromosome 17, the long end. Remember that, that's important. So DFTBA, don't forget to be awesome, that's what that means. And have a great day, guys. Bye. As a side note, since many of the other people doing Tumblr have themes to their accounts, I'd like to point out my awesome biology textbook sitting in the background of my presentation the entire time. This is my theme, biology. Yeah, biology's awesome.